When I look around the room, I see a lot of my friends, and I know they have suffered from athletic injuries. Athletic injuries are very common in the ages 5 through 24, and also even more common with males. However, when you get older and your age increases, your risk also increases. So it is still also most common with ages 5 through 24 because that is when people are most active in their life. Today I will be teaching you about athletic injuries, the most common types, how to prevent these, and how to recover from them if you do suffer from them. The most common types of athletic injuries are sprains, strains, knee injuries, swollen muscles, Achilles tendon ruptures, fractures, dislocations, and rotator cuff injuries. First up we have is the sprain. The sprain is an overstretching or tearing of the ligament. The ligament are the pieces of tissue that make up joints and connect your bones. The strain is the next. The strain and the sprain are very common and very well confused from each other and can often be confused with each other. So the strain is very similar to the sprain, except it has to do with your muscles and tendons. Overstretching, it is the overstretching or tearing of the muscle or tendon. Tendons are thick pieces of tissue that connect bone to the muscle. The next is knee injuries. A knee injury is anything that interferes with how the knee and the joints in the knee move and operate. This could include the overstretching or tearing of any part of your knee, like your ACL or MCL. I personally have had many knee problems. Earlier in the season, I had an MCL sprain from someone hitting me, and when I actually got hit and my knee moved, I could actually feel the tendon in my knee pull apart, and I could feel that overstretching in my knee. But it is very, very painful and will last a long time, which is why I want to get to how to prevent these injuries, because me myself, I've been struggling with my knee pain for the past 6 weeks. I have to wear a knee brace when I am doing anything like athletic or lifting or anything, so I would like to prevent anyone from having to suffer from any knee injuries. Another common injury is a swollen muscle. A swollen muscle is very common, and just the swelling of a muscle causing it to be weak and in pain. This would be very easy to locate and noticeable and seen. So the muscle would just be swollen and in pain and inflamed. The next is an Achilles tendon rupture. This is very serious. It's not good for anyone. And it is when the Achilles breaks or ruptures in the back of your ankle. And the Achilles is a tendon that's very powerful, and it's located in the back of your ankle. After this injury, you will struggle to walk and you will have very severe pain. The next is a fracture or a break in the bone, and this is also very common, and just when there is a lot of pressure on your bone and it fractures or breaks. The next is a dislocation. This is when a joint or bone is pushed out of their socket, and this causes swelling and discomfort. And again, I am very familiar with this because earlier in the season, again, I've had many injuries this season for some reason, but when I was lifting, I dislocated 2 joints in my back, where it was at the bottom of my spine going over to my hip. 2 joints slipped and dislocated. A lot of pain. I was going through a lot of pain throughout the day. I had to go to the chiropractor. He put them back in place, but still I had swelling. It was inflamed. There was a lot of pain. And this was mostly due to when the joints displaced and dislocated, they pinched the sciatic nerve, which is actually the longest nerve in your body, which goes from the bottom of your back all the way down to your ankle. So it just causes shock and pain all the way through your leg. I've been really struggling with that. The first couple nights, it's very severe pain. I didn't get much sleep, but now, as I've been using the preventative steps and recovery steps, I will show later, I have gotten better, and there is little to no pain now. So that is very important for these next steps. And then the last is the rotator cuff injury. This is when a muscle in the rotator cuff gets torn or overworked. And the rotator cuff is a group of muscles that keep your shoulder moving and functioning properly. Now that we've gotten through all the common athletic injuries, I would like to show you how to prevent these injuries and not have to go through any pain or suffering. So the first thing we're going to do to prevent any injuries is choose your workout wisely. So this is just being smart with your body, knowing what you're going to do, and not putting too much strain on the muscles when it is unnecessary, doing safe workouts that you've talked to your workout trainer or looked up on the internet. Anything to make sure these workouts are safe for you. The next is when you're doing these workouts, you want to use the right technique. So this is just getting low, bending your knees, making sure you're not putting too much tension on any of these muscles. Next is just get the right gear, whether this is a brace, the right sneakers, wrist wraps, anything to help you move this weight or run or keep anything just functioning properly and moving straight. Getting a warm-up, very important, because cold muscles tend to get injured more, and you want to warm up so you can take on these larger tasks, lifting heavier weights. Staying hydrated, very important, not just the working out or doing any athletic things, just in general. You always want to stay hydrated, get the blood moving through your veins, and get all the minerals you need. No excessive training. This just means you don't want to train the same thing 2 days in a row, just overworking your muscles, totally unnecessary. Just go at a steady pace and work your muscles and don't overwork them. Know when you're hurt. This is also after recovery, but just preventing further injury for yourself. If you messed up your knee, if your wrist hurts at all, don't work out more. There's no need. Talk to your trainer, and don't further injure yourself and put yourself through more pain and more recovery time. Dietary supplements, many people recommend these, just helping your body get energized and ready for a workout or an event you're about to do, just preparing your body for the work you're about to do. Next is just recovering from these injuries. Obviously, if it's just a mild injury, a lot of people are going to recommend RICE, which stands for rest, ice, compression, and elevation. For more serious injuries, you should go to your doctor, and they will suggest they will prescribe you medication. You might, if it's very serious, you might have to get surgery. And getting surgery, you might need to go through some physical therapy. Now, after recovery and talking to your doctor, they might even recommend dietary supplements to help recover your muscles and get them the minerals they need to quicken that recovery time. And then if you have one, talk to an athletic trainer. They're going to make the best decisions for you, because a lot of the times you don't know what's best for you. So definitely just talk to the surrounding people around you, and you will recover a lot faster. I hope all this helped you and makes you more informed about athletic injuries, and I hope if you do get injured, this will help your recovery time.